Well, this week, a New Hampshire man died of Eastern equine encephalitis, or triple E, after being bit by a mosquito. U.S. health officials are warning that cases of mosquito-borne diseases like triple E and West Nile are on the rise this year, especially in the Northeast. Hotter temperatures, more severe weather events, and piles of plastic trash have created environments where mosquitoes thrive, allowing insects to reach areas formerly inhospitable to them. For example, dengue cases are rising in Europe, where the disease used to actually be quite rare. The number of European countries with a self-sustaining population of a mosquito breed known to carry dengue fever has grown from 8 to 13 in the last decade. And that's why the number of locally acquired European cases in 2023 almost doubled compared to the year before. And Europe's Center for Disease Prevention and Control is warning that this year could be on track even to surpass that. It's a similar story for Puerto Rico, which has dealt with dengue outbreaks in the past, but never really to this extent. Look at this. Cases on the island are up 408% compared to a decade ago. Earlier this year, the government declared the situation a public health emergency. And it's not just that diseases are spreading to new areas. Mosquito season is also getting longer because of climate change. A 2023 study by the nonprofit Climate Central found that 173 locations across the U.S. have seen an increase in the number of mosquito days. The average increase for those locations is 16 days, but some areas in the country have had their mosquito days actually extended by much longer. These 10 cities have seen at least an extra month of days that are favorable to mosquitoes. Well, the Oropouche virus, referred to as sloth fever, has also made its way to the U.S. Florida's health department has reported 30 cases, all linked to travel from Cuba. One case was reported in New York also following travel. And Dr. William Schaffner joins me for more. He's a professor of preventative medicine, health policy, and infectious diseases at Vanderbilt University. Dr. Schaffner, always great to talk to you. First of all, what exactly is sloth fever? How do you get it? How did it get that name? Talk to us about what this crazy new illness is that's suddenly popping up on our radar.
Well, Anna, Oropouche virus is a rather obscure virus. It's native to South America and now Cuba. It occasionally occurs in large outbreaks. It is spread from person to person by mosquitoes, but also by tiny flies called midges. And after 3 to 10 days, you can develop fever, aches and pains, nausea, vomiting, feeling poorly, joint pains. This is not a fun illness, but it lasts for about a week and then will usually go away. Some people, however, feel very puny for a longer period of time and have some aches and pains in their joints. And after a week, it can come back. You have another few days of illness and it'll go away. So it's an odd virus, but fortunately, except for travelers to and from the affected countries, we don't have this virus in the United States yet.
And as you probably heard, I was talking about how many of these insect-borne, mosquito-borne, or in this case, midges-borne illnesses are spreading to other parts of the globe. As a response to all this, what can be done to prevent the spread in this case?
Well, I think what we can do is individual protective measures. You see, there are no vaccines against these diseases. So particularly here in the United States, if you go out now, please use insect repellent. Try to avoid going out early in the morning and in the evening. That's where many mosquitoes tend to bite more frequently. And go around your neighborhood and check out standing water, even in small amounts, because that's where mosquitoes can breed.
And Dr. Schaffner, we were talking also about triple E, which is a disease that most people don't think of when we're thinking about getting mosquito bites. But we know that there are several places, particularly in New England, that have been so affected or so worried about triple E that they've even shut down some of their parks from dusk to dawn. How concerned should we be about triple E?
Well, there's no doubt that people in those locations in New England and down into the middle Atlantic states need to be very, very careful. Again, get that insect repellent out anytime you go out. Wear long sleeves, wear trousers. Be careful of where mosquitoes can breed around your house. Get rid of that standing water. And that's the best you can do. And of course, particularly for older people who, if they get these illnesses, tend to get much more severe disease, you might want to stay indoors more. Enjoy the air conditioning in this hot weather.
All right. Dr. William Schaffner, have a nice Labor Day. Thank you.
Thank you.